Hello and welcome to this episode of A Cancer Conversation with the Georgia Cancer Center. I am your host, Chris Curry. On this episode, we are going to be unpacking the science and the why behind the Human Papillomavirus, or HPV, and the vaccine approved to protect both boys and girls, men and women, from developing HPV during their lifetime. Joining me for this discussion are Drs. Sharad Gamandi and Klaus Lake. Dr. Gamandi is the Associate Director for Clinical Research at the Georgia Cancer Center and also works as a cancer physician treating women for cervical cancer, which we'll talk about the connection between cervical cancer and HPV. Dr. Lay is the co-director of the Immunology Center of Georgia. First off, I want to say thank you to both of you for taking the time to sit down with me for this conversation, this discussion about HPV and the vaccine. Starting off the conversation, I want to learn a little bit more about the two of you. Dr. Lay, why don't you go first? Talk to me about what led you to a career in medicine, the field of immunology, and your passion for this kind of research.
Yeah, thank you for inviting me. So I went to medical school in Germany, and in the middle of medical school, I found out that I really wanted to be a scientist. So I took a sabbatical and had a stipend to go to Sweden and did basically PhD-like work. But I finished medical school, so I'm an MD, I'm not a PhD, and then did science all my life. In about 2000, I started studying atherosclerosis, the disease that underlies most heart attacks and strokes, and figured out in that process that I needed to study immunology to do that. And so I moved to Immunology Institute in California and stayed there for 15 years and learned some immunology, and now I'm the co-director of the Immunology Center of Georgia.
And what brought you to Georgia?
So Augusta University recruited my wife and myself, we're both immunologists, to basically start an immunology center here. There was little immunology here. As you know, immunology is very important for cancer. There are immunological treatments for some cancers, so checkpoint inhibitors, very successful in melanoma, and CAR T cells, very successful in certain types of lymphomas. So immunology has an impact and can cure certain cancers.
And now, Dr. Gamandi, it's your turn. Talk about what made you choose to follow this type of career path.
I think I was always interested in medicine. I grew up in a home environment where that was a big thing, and it was a natural progression. Went into OB/GYN because I loved OB and obstetrics, but somewhere down the line I wanted to explore more surgeries, did a small little, if you say, a sabbatical in a GYN oncology field. Absolutely fell in love with the patients and the complexity of care and problems that we solve in women who are fighting gynecological cancers, and I was hooked. And then I went did a formal fellowship, and here I am.
And you and I have done a number of stories over the years that I've been at the Cancer Center, and it always is very inspiring to see how your patients react to you and the kind of relationships that you're able to build with them during and after their treatment.
Well, I look at it a little holistically in a sense. I don't believe in seeing just the patient for the GYN cancer. So when somebody asks me what I do, I'm a primary care physician for women suffering through or going through gynecological cancer. So we are a one-stop shop. Unlike any other oncology field, I am a surgeon. I'm also the medical oncologist. So we do a whole lot of clinical trials. But during the therapy, I'm also the primary care physician. We take care of the diabetes, the blood pressure. So there's hopefully not too many things lost in translation. It's very hard for a patient undergoing therapy to go to different doctors for different pieces of their health care because it's pretty involved. And there's a longitudinal relationship with the patient. So I know them, I know their families. When they call at 2 a.m, I know their anxiety levels, and often the good part of it is sometimes I can avoid an ER visit, which somebody else would send them, and avoid unnecessary investigations and procedures just because I really know my patients.
So today we're going to be talking about the HPV and the vaccine. So I've actually been seeing a lot of commercials on one of the shows that my wife and I are watching for the HPV vaccine and talking about when to start it. So it seems like there's a good push going on right now. So I want to talk about two basic questions that people may be asking if they're watching this episode. What is the vaccine? Why should people consider getting the HPV vaccine?
So HPV stands for Human Papillomavirus, and Human Papillomavirus is an infection that can cause cancers, and actually various kinds of cancers. We've already mentioned cervical cancer, but also many head and neck cancers are HPV positive. The HPV vaccine is the only vaccine that prevents cancers. So it prevents around 80% of cervical cancers in vaccinated women, and it's basically 2 shots in the arm, and you are protected from that particular cancer that is caused by HPV. Now, HPV does not cause cancer in everybody. Most of us get exposed to HPV without developing cancer, but it can cause the cancer, and the cancer can be prevented by the vaccination.
I mean, I agree with Klaus. HPV is a very common virus. Pretty much anybody who is remotely sexually active is very prevalent. Luckily, there are only 12 strains. Typically, the worst are 16 and 18, which cause 70% of all cervical cancers. But it's not just cervical cancer. As Klaus said, it's head and neck, oral, throat, anal, vaginal, vulvar, which are luckily rarer. But those 12 strains can cause in select individuals. So your immune system is very important in patients who are immunocompromised, like patients who are HIV or people who have, say, a renal transplant, who have now immune suppression agents just to prevent a rejection. It's very hard, almost impossible to eradicate HPV in those patients, and they are very high risk. In fact, CDC has defined having cervical cancer in a HIV patient, a positive patient, as an AIDS-defining illness.
And I know that, one thing I want to stress too is we're not just talking about women, we're talking about men too. The HPV vaccine is available for both sexes.
Yeah, that's correct. I mean, obviously, cervical cancer can only occur in women, but actually, head and neck cancer is more common in men than in women. So it's not like that the men are off the hook.
And again, to eradicate a cancer or to prevent it, you really need both. We learned that lesson a long time ago when rubella was coming up, and we started having congenital anomalies in pregnant women who were affected with rubella. And just vaccinating women did not stop it. We had to also vaccinate men. And similarly, I think, it's very important to do widespread vaccination to really make an impact and prevent other stuff like anal cancers and oropharyngeal cancers.
And talk about the age range, because there's quite a range of people that can get the vaccine, the men and women. They don't have to just get it when they're young. They can get it well into their adult years too.
So all the initial studies came in the age group between 16 to 27. Then they started going younger. The younger you are, and Klaus can actually give a better explanation than me, frankly, you're more immunogenic, and young kids actually have a better response to that. The older you get, your immune system is not as immunogenic. So the initial data was up till 27. And then they did more studies to show that it was not as effective, but very effective still till age 45. So one of the common misconceptions are if you are late in getting a vaccine that you should not get it, which is not true. It may not be as protective as you get it when you have no exposure as a young kid and you're very antigenic, if you will, but it is still very effective.
So you talked about the importance of vaccinating a large percentage of the population, both men and women. And we talk about herd immunity. So herd immunity means that if enough people are vaccinated, the infection cannot spread very well because, you need 2 to tango. So if the HPV is transmitted, one of the people has to have an active infection at that moment, and then the other person can get it. If they vaccinated, that doesn't happen. Now, young people, adolescents and children have an immune system where most of the immune cells are still naive. What does that mean? So you make a lot of immune cells called T cells that you make just in case. The body does not know what kind of infection you will encounter. And if they were made just in case and haven't seen anything, they're called naive. They are not specific to a virus. If you now vaccinate that person, they have these naive cells that can become specific for that virus and then can fight the virus very well. As we age, we have fewer and fewer of these cells. So at my age, I probably have only 10% naive cells left. So it's less of these cells that you can actually affect with the vaccine.
And Drs. Gamandi and Lay, how do we know the HPV vaccination works, and is it safe?
I'll talk a little bit about data, and I'll get Klaus to talk a little bit about the mechanistic part of it. It's unbelievable. The original vaccine was a quadrivalent vaccine, which was looking at 2 strains causing the cervical cancer, which was 16 and 18, and 2 for prevention of warts. Then there was another one from a different company, which was more potent and had more cross coverage. But the current one, which is Gardasil 9, is looking at 9 different strains of HPV. 7 of them are oncogenic, and it's an incredible vaccine. 5 clinical trials, close to 24,000 patients. The efficacy is almost 98% if you do it right. All doses taken in a young kid. For cervical cancer, almost 100% for cancer of the vulva vagina. For anal cancer, it's a little less. It's in the 75% range. But as you go up in age, with some prior exposure, those numbers start dropping to mid-80s. But honestly, there is not a single vaccine we as human beings take which is as efficacious and safe. The safety profile is unparalleled. You have a little bit of injection site redness. Some people have a little syncopal episodes and faint. But there's nothing significant in terms of side effect. There have been about close to 150 million vaccines given across the wide world. So the data, the patient population, and the results speak for themselves.
So if you get, let's say, pancreatic cancer, that is bad luck. There's nothing you can do. There is no screening for it. You cannot prevent it, and it happens. But if you get cervical cancer that is HPV positive, or head and neck cancer that's HPV positive, and that kills you, and you look back at your life and you think, why didn't I get the vaccine? It would have been so easy to prevent. I think that is the attitude we promote here. And Dr. Gamandi talked about oncogenic. So oncogenic means it's viral strains that cause the cancer. There are, as you mentioned, several strains of the HPV, and they have slight differences. The HPV vaccine is recombinant. That means you can say it's artificial. It has no live virus in it. So there is no possibility that a virus could escape or do anything. There's no virus in it. It's only a few molecules that are enough for the immune system to recognize the virus, to make those T cells and antibodies. So since you're asking this question, ultimately what protects you are the antibodies. But good antibodies require help from T cells. And the T cells are the first ones to see this. And it's a complicated story. Basically, the way the immune system works, you get infected with a virus, you have to react right away. You make so-so antibodies right away called IgM. They're not very effective. But then after a few weeks, when you have all this help, you make really good antibodies. And the vaccines are designed in such a way that you make these good, what we call high affinity antibodies.
And talk about the vaccination rates in Georgia, because obviously cervical cancer is still a thing. We still see patients coming in our doors almost every day with new cases of cervical cancer. And talk about the vaccination rates and what that means.
So unfortunately, we have done better than what we have done previously. Last time I looked, we are 30th in the nation in terms of vaccination rate. Currently, it's for complete vaccination series, not just one shot. It is about 61.9%. So there's plenty of opportunity to do better. A lot of it is unfortunately physicians. I'm going to start with us, physicians not being very aggressive in vaccinating. Part of it is pediatricians, where they see that population who probably are the best people to get vaccinated, don't really see cervical cancer. So it's not necessarily in their top priority when they see kids. We don't do a better job in spreading the message as a state across all constituencies, although some of the new TV ads are pretty good, because their kids asking their parents, why was I not vaccinated, which is very powerful. It's almost like a parental duty. If you're going to get your TDP vaccine, you need to give them a cancer preventive vaccine, and that's just the way we need to do. So there's a lot of work to be done, because if I look back as a GYN oncologist, the two things which are critically important is the vaccine and screening with pap smears. So if you look at it worldwide, we are looking at 500,000 cases of cervical cancer being diagnosed every year, which is staggering, and about 250,000 plus women die of cervical cancer every year. In the United States, because of pap smear screening is better, we are looking at about 14,000 new cases, and we are looking at about 4,000 to 5,000 women dying a year. That's still tip of the iceberg, but below the waterline, there are another 50,000 women who have carcinoma in situ, which is one cell from breaching the basement membrane and becoming a cancer. The reason for the statistics are, it's a staggering number. If you look at mortality of women dying, if you look at the life years lost compared to, say, breast cancer or ovarian cancer, because people die earlier, it's not just a personal or a familial loss, it's a societal loss, because those people would have contributed a lot to the society. Now, going back to the original question, the whole reason for the preamble is staggering for me that we don't do better, because in my mind, cervical cancer is a cancer that can be eradicated. We just have to do better. I don't mind being out of a job, but we need to do better.
Well, there are plenty of other gynecological cancers that will keep you busy, but vaccinations are the most effective invention in medicine. And vaccines were invented in the 1700s by basically an accident that showed that you could prevent smallpox if you were a milkmaid and were exposed to cowpox. So that was the first vaccination. It was not a designed vaccination, very primitive, but it showed that it can work. And we think that vaccinations have saved more lives than any expensive complex surgery or anything else, because it is applied to so many people. We have currently 33 approved vaccines, FDA-approved vaccines that can be given, and they should be given. And the HPV vaccine is the only one that can prevent cancer. And it's remarkable.
And I know we talk about cervical cancer, we talk about head and neck cancers, we talk about getting the vaccine to prevent them and trying to increase those vaccination rates. But it's also worth mentioning, I think, that there are also screenings for both cervical cancer and head and neck. We do stories every January during Cervical Cancer Awareness Month. In April, we offer a free head and neck cancer screening where people can find things early, even if they didn't get vaccinated. So there's lots of opportunities to catch both those kinds of cancers earlier, which I know always increases survival rates and those sorts of things.
I mean, you can prevent it, basically. That's a nice part of it. Pap smear was designed in 1940s by George Papanicolaou. Until recently, it really hasn't changed. It's very simple. You scrape the cervix, you put it on a slide, and you look at it. You can pick up precancerous cells, because cervical cancer does not happen overnight. There's a long latent period from early changes, middle changes, and late changes, which are all precancerous. So the beauty of a pap smear is that we can pick up a precancerous lesion, fix it so people don't get cervical cancer. And now with HPV typing, and liquid-based cytology, we have increased reduced the false negative rates, and we pick up cancer better than we have ever done. It's an unbelievable test compared to, say, mammography or PSA in terms of the cost effectiveness. Historically, if you look at a cervical cancer patient, they have not had a pap smear. Over 60% of patients have not had a pap smear in the preceding 5 years. And that's a stat. And it's not because of insurance or access that people think. It's a lack of education, or in the educated class, oh, nothing is going to happen to me. And the worst offenders are people in healthcare.
And it can be a lack of trust, because if you don't trust the system, obviously you don't trust the vaccine, because you are not knowledgeable on what actually happens, how the vaccine works. And that's why we're doing these things, to get people the information that they need to make good decisions. If you have a spot on your tongue and it's found in the screening, and they take a biopsy, they take it out, and you're done. You don't get head and neck cancer. If you don't find that spot, it can kill you. So it's a very different beast.
Well, I want to thank both of you for joining me for today's conversation about HPV, the vaccine, its efficacy, and whatnot. So thank you for your time. Thank you for the information. If any of you out there are listening or watching and you want more information, you can certainly send us an email, cancer@augusta.edu, and we'll pass those questions along to Drs. Gamandi and Lay to get their expertise and their insight and share the answers with you. Please remember to subscribe, leave us reviews, let us know how we're doing, let us know if there are cancer-related topics that you want us to cover. We have a number of different experts here at the Georgia Cancer Center, and of course also the Immunology Center of Georgia. And so we look forward to doing all that we can, because knowledge really is power, which is one of the main reasons why we do these sorts of interviews with people like yourselves.
Thank you.
Thank you very much. I appreciate the opportunity.